Alright, so this is the frequently asked questions session, or rather, it is fever questions asked. FAQ is normally what we consider in normal parlance, but this is specifically a session for answering all your fever related questions. So, it is, I would say, rather, it is FQA. So, any questions? Good to see you, Dr. Somesh Mithun. Any questions that you have for fever or anything related to fever? So let me see in my chat box. I had received a few queries from participants. How to take a fever case when so many symptoms are presented by the patient? This is one of the questions. And I had put one question on the story. If you have asked any question, or if you feel like asking, you can also drop in the comments. So one of the main question by the viewer was how to take a case when so many symptoms are presented by the patient. So I have made a pro forma basically, and you have to categorize the symptoms of the patient into that pro forma, and then you will be able to understand how you will analyze the case. So first step is segregation of symptoms, that is important. So that pro forma is what I will be taking up in the fever workshop. So second thing, for virus related fevers, what is the medicine? I can't shout more than this, Dr. Vineet Mathuria. If you have earbuds, it will be more than good audible. So for virus related fevers, what is the medicine? Normally in homeopathy, as you all have been taking the cases which are relevant and which have the concept of following the PQRS symptoms of the patient, location, sensation, modality, concomitant. Similarly, you will have to follow a pattern in fever cases also. If you understand what is the pattern to be followed, for that you need to know what is the uh, you know pattern that is presented in the fevers. Then you will understand how and where you will categorize and understand it. You can say that there are remedies from aconite, belladonna, pulsatilla, nux vomica, arsenic, sulfur. Every remedy can be given in fevers, whether it is viral or dengue or malarial fevers, provided the symptoms match. For that, you need to understand how the symptoms of fevers are presented in different remedies, and you will be able to prescribe those medicines in fever. सो डॉक्टर शैशव कुमार, हिंदी में लेक्चर मैं दूँ आपको, मैं कोशिश करूँगा, पर हमारी ऑडियंस में काफ़ी सारे लोग इंटरनेशनल भी होते हैं, इसीलिए मैं कोशिश करूँगा कि मैं दोनों लैंग्वेजेस को लेके चलूँ साथ में. सो आपको चाहिए कि टाइफॉइड फीवर में क्या करें. बेसिकली टाइफॉइड फीवर आप समझेंगे पहले तो कैसे वो स्टार्ट होता है और कैसे उसका प्रोसेस होता है, वो आपको समझना ज़रूरी है. हर एक फेज़ में अलग अलग सेट ऑफ दवाइयाँ काम आएगी. पहले फेज़ में क्या, दूसरे फेज़ में क्या, तीसरे फेज़ में क्या, पेशेंट के सिम्टम्स कितने मैग्नीफाई हो चुके हैं, पेशेंट की पिक्यूलियर सिम्टम्स, पिक्यूआर सिम्टम्स कितने ज़्यादा इंटेंसिटी से दिख रहे हैं, वो देखने के बाद हमको दवाई डिसाइड करनी आएगी. एक इंस्टाग्राम लाइव या यूट्यूब लाइव का ये सेशन नहीं हो सकता. इसी के लिए मैंने वर्कशॉप रखी है, जहाँ मैं अलग अलग तरह के फीवर लूँगा. वायरल फीवर, डेंगू फीवर, मलेरियल फीवर, टाइफॉइड फीवर, फिर और भी कई तरह के फीवर है जो मैं इस वर्कशॉप में लेने वाला हूँ, जो कि 15 अगस्त से शुरू होने वाली है. तो आप लोग उस वर्कशॉप को ज्वाइन करेंगे. उसमें आपको सिस्टमेटिकली सारे नोट्स दिए जाएंगे, आपको रिकॉर्डिंग्स मिलेगी, आपको पावर पॉइंट्स मिलेगी, एंड यू विल अंडरस्टैंड हाउ सिस्टमेटिकली फीवर केसेस हैव टू बी सीन. प्रोफोर्मा विल बी गिवन टू यू. एक प्रोफोर्मा दिया जाएगा जो कि आप फॉलो कर सकते हैं आपके क्लिनिक में. जब आपके पास फीवर केस आएगा उसको कैटेगराइज कर सकते हैं, किस तरह से सिम्टम्स कब शुरू हुए हैं और क्या क्या पेशेंट को दिक्कतें हो रही है. And then you will be able to understand by segregating the patient symptoms in different sections. You will understand how the patient has to be analyzed. One of the major areas which I feel homeopath has been lacking is, or needs help rather, not lacking, I would say, I would say it, you need a help is analyzing the cases, especially the fever cases. And that is what the workshop is all about. For Indians and internationals, there are two categories. You can contact the email address which will be there in the posts, in different posts in YouTube, Instagram and Facebook, for you to understand how to register, what will be the cost and how you can pay to me, and then we'll give you the entry. There are a lot of people who have already registered and some are in the process to register. You can get your book your seat and get access to it. So any other questions? So Dr. Somesh Mithun, how to contact you? You are on Instagram. You can drop me a message. I'll take forward the conversation from there. Drop me a message on Instagram message chat box. I will take your conversation further about what specific query that you have. So that is about the different fever cases that you will see in the clinic, and how will you analyze and segregate them into different categories of symptoms, just like we have symptoms of Boniosin which he has categorized: location, sensation, modality, concomitant. Similarly, for fevers there are more number of categories that you need to understand, and for that this proforma which I have created, that will be given in the fever workshop which starts from 15th August. So those who are eager to join, you can understand that whether it is viral fever, whether it is dengue, malarial or any fever, you should at least know how to analyze the case, how to prescribe the medicine. That is one of the most important thing for homeopath. So that is why we have kept this workshop. I answered couple of queries from you, how to take the fever case, and what for virus related fevers, what is the medicine. So the medicines can be from aconite, belladonna, arsenic, gelsemium, anything. So Dr. Somesh Mithun, one more question from you. Doctor, for fever cases should we take mental symptoms? So again, when we go back and see how our masters analyze the cases, sometimes in some cases there is a hierarchy. एक तरह से एक हायरार्की होती है, जैसे कि क्या सिम्टम को इम्पोर्टेंस दिया जाना चाहिए. तो हाउ विल यू अंडरस्टैंड विच सिम्टम इज टू बी गिवन इम्पोर्टेंस? आई एम स्पीकिंग इन बोथ द लैंग्वेजेस सो दैट some people who want the lecture in Hindi can understand it more easily. So which symptom should be given importance? It depends on what emphasis the patient has laid on in his case sharing. किस symptom पे patient ने दबाव डाला है ज़्यादा? Whether patient has put more emphasis on the child. Suppose it's a case of child. शायद ये बच्चे का केस है जिसमें मदर बोल रही है, मदर इज टेलिंग दैट the child keeps on moaning at night, constant moaning at night. Whenever there is fever there is moaning. So the mother, माँ बोलती है कि बच्चा रात भर मोर्निंग करते जा रहा है, एक आवाज में बोल रहे हैं. तो अगर ये फीवर के समय है, if this symptom is more predominantly seen in fever and more often it is seen again and again, बार बार ये दिखाई दे रहा है, 2-3 एपिसोड फीवर का आया, again and again you see that this is happening, then you will need to take this symptom into consideration along with the other symptoms. How will you categorize? What will you categorize? That is a part of this workshop. You need to register to understand it more better. It is going to be an interactive session, just like how it is right now with me on Instagram and YouTube live simultaneously. So you can definitely get a good experience. At every 10-15 minutes I will definitely take a pause and it will be an interactive session answering the queries moving forward. How important it is to get the blood test, or can we start before testing? Good question, very good question, Dr. Priyanka. So many times I would say that patients land up in our clinic with very few symptoms. If they know that you can treat fevers or you can handle acute cases with good confidence, they will land in your clinic within a few hours of developing symptoms. पेशेंट आपके पास तुरंत आ जाएगा जैसे ही उसको सिम्टम्स डेवलप हुए हैं. तो it is advised that you give the medicine in few doses first and then go further and investigate if the fever is not helping. Right away giving them or sending them for investigation is will be kind of put off. This is what allopaths do because they don't have any other mode of giving antibiotics than to see if neutrophil is high, WBC is high, platelet is low, platelet is high, Vidal is positive or negative, and other symptoms. So we'll need to wait for 12 to 24 hours before going or sending them for investigations. Okay. So Dr. Bhavithran, hello doctor, you had a wonderful seminar at Kanyakumari. Thank you very much, and I appreciate your words. So there is an upcoming workshop which I am doing on fevers. You can definitely be a part of it and get the confidence to treat fevers. So I am answering just a few questions which the audience feels are important, and normally it is frequently asked questions, but I changed it to fever questions answered. So it is not FAQ, it is FQA. And this is the need of the hour because it's a monsoon season in India. Elsewhere it will be cold, it will be hot, whatever be the case. Homeopath needs to deal with fevers whenever they come in their clinic, and if you want to be more capable to handle such emergencies, it's an emergency, yes, because if the fever doesn't reduce, the patients can go to allopaths, they can go to hospitals, they can go to super specialists and get the treatment right away, and within a day, something that you're not able to treat within 2 to 3 days, within a day or within few hours, the allopath treats. So you need to develop that confidence, और इसी confidence को develop करने के लिए मैंने ये workshop का concept किया है. Earlier we have done few other workshops, which is case taking, rubric workshop, kingdom differentiation workshop. These were the 3 workshops we did in 2024, and this is the next workshop, fever workshop, which I am coming up with. Those who wish to join, they can just find all the details in the YouTube posts. There is a tab community, or in Instagram there are posts which have all the contact details, and you can definitely contact and get to be a part of this workshop. You will get notes, you will get recordings, you will get case taking pro forma. It will be an interactive session, and more importantly, whatever cases you feel are important to be discussed, which you have seen in the last whatever years of your session or clinic, and anything that you are currently facing, we will be discussing those also. So I think that's all from me right now, and thank you, Dr. Vineet Mathuria. I appreciate your words also for the Kanyakumari seminar. It was really good. I was in good spirits. Most importantly, the food was very good. The rasam was not spicy, if you understand the joke, what I mean, from the seminar. So that's it. I would say, if there are any questions by any other attendee, please feel free to drop before I call for a closing of this session, and we'll meet again tomorrow first in the evening 5 p.m. before I start the clinic. It will be Allen's keynote study streak, And at the end of the clinic, 9:30, I will 9:30 preferably, I'll do a fever questions answered, FQA answered, for all of you who wish to ask any questions related to fevers or what will be there in the workshop that you'll be getting. It's going to be an incredibly powerful session. You need to join that to change your perspective about fevers and develop the confidence which you need to take yourself forward. You shouldn't be a doctor who is treating skin diseases which are lingering for 20 years and 10 years and just treating that functional disease, that is acidity and joint pain and everything. You need to be a doctor who proves your science every day, and that is what we should be built for. Okay, so what is the scope of repertory in fevers? Yes, so there are many repertories: Kent, Poninosin, especially BBCR rather than BTPB. BBCR will be more preferably essential. Near repertory, and then there are some smaller repertories. Then there is a repertory by On Fevers by Allen. I refer all the repertories depending upon how the case is. The scope of repertory in fevers is that you firstly, I would say that it is more of a general topic which we should take. What is the scope of repertory in acute cases? And if I would elaborate that, it would mean that to study something which is precise or which is exactly only symptom in the patient, we would not know if we are only touching the materia medica. So in materia medica, pain in the throat, you may know belladonna, Merxol, Eparsol, Phytolacca. But when you open the repertory, you see pain in the throat, you get 200 remedies. Okay, number one. Number two, you go in the sub rubrics and you see the sub rubrics, and there are sub rubrics which will probably lead you to understand what is the specificity of that throat pain. Is it morning? Is it night? Is it evening? Is it while swallowing? Is it while exposing to air? And what not? There are lot of permutations and combinations. All these permutations and combinations you will not know from the materia medica unless you are really an expert in grasping the materia medica, which is difficult. It takes time. It takes 20 years, 25 years, 30 years, depends on your level of intelligence and grasping knowledge. So the repertory is useful in acute cases or in fevers from that perspective. For example, there was a patient yesterday, a homeopath, and she has been attending a lot of my workshops. She reported to me with complaint that her daughter developed fever. She was feeling better, okay, with nux vomica, but the headache was there which was not getting better. If you go to Kent repertory, chapter perspiration, rubric symptoms ameliorated while sweating except the headache, there is only single remedy which is natramur. So in this way I gave her natramur, and actually if you see, there is some book which mentions that after nux, if the symptoms have not gone, prostration is too much, you give natramur. I told her to give natramur 1m. It's been 24 hours now. She took natramur 1m 1 dose yesterday. Now the headache is gone, the weakness is gone, and she feels better, she eats better. So depending upon this small one symptoms ameliorated by sweating except the headache, this leads me to natramur, and I prescribed a natramur. So in this way the repertory is very useful, because you have to understand from the smaller rubrics, and these smaller rubrics will take you inside the remedy. From that, it will be the key to open the remedy. So that is one of my key indications for natramur, and this is how this is not just one symptom of natramur, but there are many other symptoms of natramur which I will be discussing. It's a good remedy, especially useful in malarial fevers or in fevers which are having a typical pattern. What is that pattern? What are the symptoms? I'll be discussing in the workshop. So those who wish to join, those who wish to enhance their knowledge of fevers, of the remedies used in fevers, I urge them to join this workshop. All the details are available in the profile, so you can find out and you can join. So that's it from me right now, and we'll take a break till tomorrow, and tomorrow evening we'll take up Alan Skinner's study streak, and then we'll continue with the fever questions asked or answered in the evening after the session. So yes, Dr. Vineet Mathuria, please use earbuds. Tomorrow I'll take this tip from you and I'll use earbuds. So my clinic is in Mumbai, in suburb of Mumbai. It is known as Virar. So it is not a proper Mumbai town per se, but it's like 1 hour from Mumbai. So it's a kind of a semi-urban, semi-rural area where we get a mix of patients: chronic, acute, subacute, rural population, and urban population. It's kind of a suburb. So without wasting much time, everyone has got their answers, and I also got my answer to use earbuds. So we'll uh, modify the session more improvised tomorrow, and we'll meet tomorrow. Okay, thank you everyone for joining, and good night.